sidelined with an injury? Make sure you consult a certified athletic trainer who specializes in the prevention, assessment, treatment, and rehabilitation of injuries and illnesses. Avoid injury and stay active with an athletic trainer. A reminder from the National Athletic Trainers Association, nata.org, during National Athletic Training Month.
Welcome back. Here to inform us about National Athletic Training Month and some of the roles and responsibilities of an athletic trainer is the athletic trainer for the Calgary Roughnecks for the National Lacrosse League. So, can you tell us exactly what an athletic trainer is?
Of course. An athletic trainer is an allied health professional specializing in injury prevention, acute care, clinical evaluation and diagnosis, organization and administration, and rehabilitation.
We practice preventative methods every day during treatments and practice to ensure the health and safety of our athletes. We also administer concussion screenings to measure baseline results of athletes in the event of concussion. And we conduct pre-participation screenings prior to each season to ensure our athletes are healthy enough to play. As athletic trainers, we are trained as first responders in the event of an injury. We perform initial assessments and within the first 30 seconds make decisions regarding the activation of EMS based on the athlete's level of consciousness and the severity of the injury. We also treat non-catastrophic injuries such as blisters, abrasions, and sprains. Athletic trainers play a major role in injury diagnosis. During initial assessment, we take SOAP notes. SOAP is an acronym for subjective, as in level and description of pain, objective, where we obtain an accurate patient history, assessment of the injury, and planning, or how we're going to treat the injury and manage rehabilitation. Athletic trainers design and implement rehabilitation protocols that are customized to each patient. We continually assess strength and range of motion of the injured area and adjust rehab programs accordingly. We use therapeutic modalities to treat injuries, such as ultrasounds, stim, and massage. We also fit athletes with protective padding, wraps, and ambulation devices. Athletic trainers also play a role in organization and administration. As athletic trainers, we follow a code of ethics established by the National Athletic Trainers Association, which helps assure a high quality of care to our athletes and patients. We are also able to run our own facilities, comply with accrediting agencies' standards, and maintain accurate medical records. Every day we strive to promote our profession and make it more respected.
So, it seems like you're trying to get away from the term trainer. What exactly is the difference between an athletic trainer and a trainer?
Well, every time I hear the word trainer, I think of a personal trainer. And athletic trainers and personal trainers are completely different. As stated by the NATA, an athletic trainer is an expert at recognizing, treating, and preventing musculoskeletal injuries. Whereas a personal trainer's job is to really just implement workout schedules and workout designs and physical fitness programs and manage clients. We actually work with patients.
What are some of the different educational requirements for becoming an athletic trainer versus a personal trainer?
Well, an athletic trainer has to obtain at least a bachelor's degree, and around 70% of athletic trainers actually have a master's or doctoral degree. They have to keep education up to date. They have to take a lot of continuing education classes, become recertified. The education process for an athletic trainer never really ends. For a personal trainer, I mean, you can take classes at places, but it's not really required to have any kind of higher education or degree to be a personal trainer.
Do athletic trainers and personal trainers have to be certified to practice in their fields?
All athletic trainers have to pass the same board certification exam in order to become a certified athletic trainer. Personal trainers can be certified by any number of different agencies. There's no unifying body. There's no really rhyme or reason to it. And a lot of personal trainers can just practice without being certified at all.
What are some of the differences in the day-to-day tasks of an athletic trainer versus a personal trainer?
Well, day-to-day between an athletic trainer and a personal trainer really varies a lot. Athletic trainers focus on preventing, diagnosing, treating, and rehabilitating chronic overuse and acute injuries in athletes. They do this in coordination with physicians and really just a plethora of other healthcare professionals, people in the medical community. Personal trainers really just work with clients to set up and achieve specific specific fitness goals for their clients. Athletic trainers also work at a very high, work towards very high ethical standards and maintain patient confidentiality. There's just so much more professionalism involved and required when it comes to athletic training.
So the theme for this year's National Athletic Training Month is Not All Athletes Wear Jerseys. Could you explain to us what this means?
Of course. See, athletic trainers are really known for working with athletes, whether at the high school, college, or professional levels. What most people don't realize is that we work with populations at all levels of physical performance and labor.
There are athletic trainers working with the military and industrial settings, with the performing arts, and clinics and hospitals as physician extenders, and even with local, state, and federal branches of law enforcement and government. The spectrum of care that we provide encompasses an entire population of workers and professionals who need day-to-day exercise protocols, rehabilitation plans and treatments, as well as essential injury prevention, planning, and development. The message that we want to get out to people is that we're here as skilled allied health professionals to treat the athlete in you. So next time you've got an injury, ache, pain, or just have some questions, go see an athletic trainer. You'll be glad you did.